My name is Jonathan Rodriguez. I'm from New York City. I was born in the United States to two parents who are from Lima, Peru. And I'm here in Takiwasi treating heroin addiction and addiction to various pills that I was prescribed in the United States. I found out about Takiwasi from my psychologist, who had sent various other patients here in much worse conditions than I was, and she said that they get cured, or they're very well treated for their addictions here. I was very skeptical about the whole process coming here, detoxing off of heroin and various pills using plants. It generated some sort of very, very, very heavy skepticism in me, because I'm used to traditional Western medicine, which is based a lot on injections, pills, in treatment, inpatient treatment in hospitals, and medical attention around the clock. And that's not what it's like here. Here it's based on traditional Amazonian medicine, which is much more simple, but also has extremely complex intricacies within itself. And the detox process here was very different than in all the other centers that I've been. This is my 9th time being in an inpatient rehab facility, and the detoxes that I had gone through before this were varied, but all within the same structure of detoxification medication and round-the-clock therapy with anxiolytic medication to keep anxiety at bay. And here the detoxes are mostly based on purgative plants. So I arrived here, and within 24 hours I was taking a purgative plant. Little by little, as I kind of gave myself into the process, I noted that the purges are really important here. So there are various purgative plants that we take here for spiritual needs, therapeutic needs, and interpersonal needs. So I've been here for 6 months already. So far I've experienced basically all the aspects that there are in this treatment, from purges to the dieta to Ayahuasca sessions. There's also a community living facility here. We're inpatient with various other patients. Currently there are 10 of us, and these are basically the aspects of the therapy here. They integrate with your psychotherapy, and they all form kind of a unit for therapeutic use. For me, the most important part has been the dieta and the plant use in general, because it's something that's not really familiar to me, coming from a more Western, conventional style treatment center. It's hard to explain to people who haven't gone through the process, but you feel the effects, whether subtle or extreme, they're there. And I think that's something that a lot of conventional Western medicine tries to replicate, either with pills or injections or any of the aspects in their psychotherapy. They want results, and they want them fast. We get results here working with plants, but they're not immediate. So it's not as easy as taking a pill, waiting 30 minutes and feeling better, which is kind of why we have to go up into the jungle and stay there for 7 days drinking these plants. So what I think is important to see, but also the most effective part of this process, is that we have to see the contrast between instant gratification, which is what a lot of addicts are used to, and then the gratification that we can get from a sustained therapeutic process, like we do here with plants. It's a little bit of the opposite of consuming drugs. When you take plants, you might feel uneasy, your stomach might be unsettled, you might feel nauseous, you might feel cold, you might feel hot, you might feel scared. But in the long run, it gives you a much better result, as opposed to with a lot of conventional Western medicine, or at least medicine in the United States. You take a pill and you feel better for a few hours, but in the long run it's doing you more harm than good, because you become addicted to the pills and you become dependent on that medication, and you never really get to look into the problems that you're living, because you're blinded by the medications. With that being said, I'd like to invite all of you to help cooperate with ATOP, the Ayahuasca Treatment Outlook Project, in in helping people like me and people who have other problems that are not related to addiction to help finding themselves. I've gone through a process here where I haven't just seen results, but I've lived them, I've experienced them, and I think that's really important when it comes to treating mental health issues and drug addiction issues, because there's a lot of covering up. There's a lot of don't feel the pain, get rid of this, put that aside for later. And here it's more of a look at this and resolve your problems. And I think that that's really important, and I think that it can help people not just here in Peru but on a scale worldwide, because I think that the things that we have otherwise are not really working. And for me, this is one of the most important things that has ever happened to me, was coming to Takiwasi and experiencing this change of lifestyle, from living on the streets and being scared of not ever going back to school and not having money and fearing disease, to living healthily and not just confronting my addictions to drugs, but to commodities, my cell phone, the internet, interaction that's meaningless. You kind of get based down and back down into reality, and you feel the earth, and I think that's what's important, and that's what they're propagating here, and that's what ATOP is contributing to. And so I invite you to cooperate whatever you can. Thank you.